Welcome to my life. My name is Dr. Adeze Cosmos, and I know you don't want to know my name. What you want to know is how you are going to avoid UK failure in the GOC interview. And I want to apologize for using that word failure because you can't really fail the interview. Obviously, there are different outcomes that will come from the interview, and the way you perform will then determine the kind of outcome that you get. So I won't be using that word failure, but what I would say is I know that you want to know how to go into that interview and come out with the best outcome. And that's what we're going to be looking at in the live this evening. It's going to be a very brief live because I have been so busy and I am really ready to wind down for the day. After work, I had to go into my kids' school, but I did not want to, disappoint. So I'm here for you right now. Awesome. Good. So I want to say a big welcome. And once you come in, I want you to put in the chat for me. If you are watching on the live, say hashtag live. And if you're watching on the replay, go ahead and say hashtag replay. Now, I'm not using any mic. So I want you to, could you let me know if you can hear me? I'm going to try and test it myself as well. Let me see what I can do. I want to know that you can hear me so that I can, excuse me, keep going. Let me see. If you can hear me loud and clear, just put it in the comments below. I'm just going to ask you a quick question as you're coming in right now. Thank you so much for joining the live. Now, just to be clear, if you are an international optometrist, you're aiming to qualify in the UK, this life is definitely for you. But it's for you only if you haven't sat the GOC interview. So if you've sat that interview, then this life, not for you, but I know that you know so many people that would be in need of what we're going to be talking about. So if you can go ahead and, whoa, I'm loving the picture quality. I can't but announce to the world that my husband got me a MacBook Pro. the the picture quality is amazing, and I don't know how the sound quality is. So can you let me know if you're watching right now, whether you can hear me while I continue? Okay, so this live is for you if you are aiming to qualify in the UK. Remember, as you come in, I want you to just say hashtag live if you're watching on the live and replay if you're watching on the replay. Also, I'd like you to let me know what part of the journey you are at. Okay. And then if you have any questions as we go along, just go ahead and put it in the comments below. Thank you so much for coming in, all of you trickling in. Awesome. Keep coming in, and as you come in, go ahead and share the stream. And as you do that, I say a big God bless you. Where's my chat? All right, let's get going. Okay, so let me ask you a question. How many of you have felt unsure about how to prepare for the interview? Actually, I think I need to, let me try and share this. Just going to try and share this. I'm just going to check my sound as well. Just bear with me. Because I know some of you are going to be watching on the replay. I want to make sure that the sound is cool. I'm just going to check my sound. Good. The sound is good. Awesome. Awesome. And then I'm going to share this. So if you're on the live, go ahead and just like. Okay, let me just share this to this platform. And share, please. Thank you. Right. Okay, all housekeeping is done. I know that everybody is in. So, cool. Now, we're going to get started now. Get your pen, get your paper out, and then we're going to get started. I'm going to teach. I'm just going to roll through everything I want to share with you today. And then at the end of it, I'll be taking your questions. So as I go along, just keep putting your questions in the comments below. Now, this applies to whether you are live or on the replay. As you go through, ask your questions, and I would definitely be answering them, whether on the live right now. I may answer it on the live when we come tomorrow. Maybe if you missed the live today, or I can actually just respond to you, whether in the DMs or on the post. Okay, so whilst you're watching right now, I'd like to know where you're watching. Are you watching it on YouTube, on Facebook, or on LinkedIn? That would be really helpful for me to know, where my audience and the people I'm sent to help are. Great stuff. So let me ask you a question. How many of you felt or are unsure about how to prepare for the GOC interview? Or worried that even though you are a capable, clinical, competent optometrist in your country, you may not present your answers in a way that the assessors expect. Now, if that's you, you are in the right place tonight, because I'm going to show you exactly what the GOC interview is really testing. And I will be exposing, from my experience of over 10 years of mentoring international optometrists and even being a period supervisor and an assessor myself, not a GOC assessor, but an internal assessor for the company I work for, why many people fail even though they have clinical knowledge. Okay, and we're going to talk about a simple framework you can use to structure your answers with clarity and confidence. Now, if that's going to be helpful for you, I'd like to know in the comments below. Great stuff. Awesome. Right, let's keep going. Thank you so much for coming in, and thank you so much for watching. Even you on the replay, I can see you there, and I'm honestly rooting for all of you. And I hope that this meeting tonight will be so helpful for you, so that when you go into your interview, you come out with flying colors. I thought someone would type in a believing amen. All right, quick background. When I was preparing for my GOC interview, I've shared stories of brilliant colleagues whilst we're doing our own personal study. They're answering questions, they're doing so well. But when it comes to actually answering questions in the midst of, the tutors that were doing tutorials, and even in the interview hall, we begin to see them just fall into pieces. And the GOC interview, like I always say, is the pivotal part of your UK qualification. Once you pass that, I know there are other challenges, but once you pass that interview first time, you saved yourself time, you saved yourself money, a lot of anxiety. It's just you keep moving forward. And so it's, from my experience, it wasn't really about because they didn't know optometry, or they hadn't studied, or they hadn't prepared. It's because some of them I've seen, did not prepare in the right way. Some people just had done their own studies behind closed doors and to themselves without really going through a process that can help them to fine tune their answers and fine tune even their mindset, their mental health, so that they're able to perform under pressure. Okay. And this is exactly what inspires me to start helping international optometrists from my own journey and from, people coming around and being so downcast and the things that they were going through. This is what has fueled all the things that I do, whether it be lives, whether it be webinars, whether it be the programs we run in the academy. Everything is geared towards ensuring that no international optometrist goes through that confusion or frustration, that they feel supported. Do you get what I mean? To qualify in the UK. Right, let's move on to the truths about the GOC interview and things that you need to know. Well, the GOC interview isn't just whether you have the clinical skills. Remember, you've done your QC and they have seen that you are an optometrist practicing in your country. But it's about how you are able to demonstrate, each competency when you're asked a question in that particular competency under pressure. It's also about whether you can communicate your answers in a structured and comprehensible way. Because when you're speaking to the assessors, it's not just I got the question right. And this is the reason for which some discussions I have with some international optometrists, sadly, they say to me, well, I don't even know why I got an adaptation. I don't even know why I have this many adaptations, because for the much I know, the questions they asked me in contact lenses, I was able to answer. The ones they asked me in this particular competency, I was able to answer. But it's not really about just answering the clinical side of it correctly. It's about whether the candidate can communicate in a structured way, in a way that the assessors can see and feel confident that the optometrist, if testing in a test room right now, will, number one, yes, know how to do the test, know the order in which the tests are run, but also they will be able to communicate to the patient their diagnosis and the management plan in a structured manner without just, going beating about the bush and then finally saying something that looks like the answer. Okay. And then it's whether you can connect the knowledge to the patient's outcome. So what they said when they came in, what was the result of the tests you've done, what are the patient outcomes, and in a safe manner, respecting boundaries. And that's where the professionalism and communication comes in. And this is where many fail. They memorize notes, but don't practice answering the questions in a structured manner. And it's not really even practicing structured questions, because one thing I see that a lot of people do, even they're in groups and they're just going through answering the questions. But one thing I always say is that when someone comes out of the interview hall, those questions you see are their memory of the question. Now, you don't have information of the base of that question. Why did the assessor ask that question? Sometimes you see the questions and they would say, and they were, and the assessor was grilling me here. You don't know what the candidate said before the assessor asked that question, and you're not even sure of the answer that triggered the follow-up question. And that is why it's so many people would fail and not come out with their desired outcome, because they are studying only the questions, which is very surface level. Okay, so some others do not get desired outcomes because they give clinically correct responses, but they don't cover the indications in each competency. Now, just to let you know that when you sit the interview and they ask you any question in any of the competencies, the assessors have got what we call the rubric. Let's say the indicators. So as they're asking you the question, whether they do it on the spot, I don't know. Whether they transcribe the recording, and then they just begin to mark, okay, when it comes to this particular competency and these indications, they've all been marked off. Now, if you see some of the outcomes, you would see that they say needs maybe training competency in 3.2.1. Why? Because the answer didn't cover all the indications in that particular competency. And for some others, they just ramble or they freeze because they don't know how to organize their thoughts. And they just like suddenly they're in that interview, they clocked up and they see these two assessors and it's like, you know, and they don't know how to translate their international experience into UK context. I have a lot of people coming for meetings with me, and one of the very common things I hear international Tom says that I don't even know the structure. I don't know how far I'm supposed to read. I'm not even sure what they want me, how they want me to answer, how deep they want me to go. And so one thing we know and one thing I know is not getting the desired outcome is not just disappointing, but obviously it's costly. It's lost time, lost money, stress with visas, months of waiting. And, especially if you are, for candidates that are in the country on a particular visa that is timed, maybe finish masters and they've got 2 years, and then hopefully get into optometry, get the skilled visa to continue. So it's really important that if you are going through the UK process, that you take this particular life that I'm doing very seriously. Okay. Now let me go through with you the thought patterns that some candidates, and I would say this is majorly the biggest mistake that a lot of people make. Some people prepare for the interview as if it's an academic exam, and it's not. It's a discussion about you and your patients. It's more or less a competency indicator interview. Okay, it's not an academic exercise, but we're not going to push the academics away. You need to know the academic foundation and back it up with your clinical knowledge based on the competencies. Okay, and another, you may have heard me talk about this tactic that some people have a game plan going into the GOC interview, and one of them is we're going to use our network or our microphone as an excuse. So they ask a question that the candidate doesn't know, and the next thing is like, hello, can you hear me? Oh, this network, I'm just going to move, can you hear me? It won't work. Some others begin to say, okay, I'm just going to begin to say, I don't know what I'm going to say, but I'm just going to begin to speak everything around. No. And then while some others, they get so relaxed and they forget about professionalism. They forget about communication. They forget about respecting the practice that they are, even like the country and the practice where they're practicing from. Because when the assessors are assessing you, they're not just assessing what you're saying, it's the mannerism, the way you communicate, what type of clinical professionalism oozes through you. That is what, that is also very important. Right. Have we got any questions coming through? Remember, if you've got any questions, put it in the comments below. And I want to thank all of you for watching right now. And I hope that as you're watching, you're getting some value out of what we're saying. Now, how best can this be fixed? There's so many things. It's not something that I can cover on a live, but there's so many things. Number one is getting a framework. You can even choose your own framework, but you need to find a framework so that as you are going through the cases in your clinic, even as you're seeing patients in clinic, or you're going through your memory and you're just looking through down, especially those of you that are already in the UK, and you're looking down memory lane about the patients that you've seen in different categories, falling into these 8 competencies. I want to believe you know the competencies, isn't it? Because if you don't know, just look at your form. You will see all the competencies there: professionalism, communication, optical appliances, contact lenses, binocular vision, ocular diseases, low vision. Uh, there's visual field, there's low vision. Yes, sort of that. Okay, so that's what we're talking about. So, but today I'm just going to pick up one framework, which is the STAR framework. I did a very extensive explanation of the active framework you could use. I think that was when I did a live on Saturday. So let's talk about the STAR framework again. What does STAR mean? Situation, task, action, and result. You can begin to use this particular framework. It's quite really short, just four parts of it, and use it to structure the answers as you would answer in the interview. Okay. So the way it runs is S is situation. So let's say we have a 45-year-old presented with sudden flashes and floaters. So that's the situation. You need to give that situation back to them. So number 1, 45. Number 2, they've come in with flashes and floaters, but it's sudden. Okay. The next thing is the task. Your task, what is your responsibility? Now, your responsibility is to understand the actual triggers in the question that they've asked. Think about the competencies and the indicators that are involved in this particular situation, and then you take it to the next level. So once they presented a 45-year-old with flashes, sudden flashes and floaters, then understand that it's my responsibility, number 1, to look at the question and bring out the actual triggers in this question. And for me, the triggers are sudden flashes, floaters, regardless of the age, because they've just said an age, and we know when it comes to flashes and floaters, anyone can have it. It could be a child, it could be an adult, it could be a young adult, it could be even a geriatric patient. So I'm not too concerned about the age of the patient. It's all about the sudden flashes and floaters. And so then it's your responsibility to say, well, yes, it's the patient is 45 years old. There are things that I'm going to be looking at when I'm taking care of this patient. But for me, thank you for this question. I'm really looking at the suddenness of the flashes and floaters, because then I have a task to check and see if this is. And usually when you're doing your task and thinking about your questions, you're thinking from worst case scenario, like high risk scenario, to very low risk scenario. And the high risk scenario for this patient will be a retinal detachment. Okay. And then after that retinal detachment, you will be thinking a retinal tear. And then you go down to a retinal hole. And then you go down to a PVD. And then you begin to look at other things as the patient, as you ask the question, and they begin to, even explain what they mean by sudden. Sometimes you question them and they say, well, sorry, it's actually been there for 3 years and all that sort of thing. But whenever you hear any question coming to you, you want to think from high risk to low risk. Where is this question? This question is more going to be on assessing your ability to understand the high risk that could be associated with sudden flashes and floaters. The next thing you want to think about is your action. What steps do you need to take in order to see this patient? And I always say, when you're going into the GOC interview, don't just go into the interview hall, step into your consulting. You need to see this patient as a patient that's walked through your door and is saying, I've come to see you today because I have sudden flashes and floaters. The way you will discuss the case with the assessors is the same way you're going to be seeing the patient from your case history. I call that phase 1. And then you get into phase 2, which would be all your investigative tests. And obviously, in this investigative test, they would expect that you begin to talk about the exact questions you're going to be asking in the case history, the exact tests you're going to be doing. This is not talking about all the tests, obviously, the exact tests you need to do for this 45-year-old, such as, doing the VA, checking if the pupil, checking the pupil reflexes. And then you go into your external eye based on the questions you asked. And in external eye, you're just looking at the anterior chamber depth, because if there's a sudden flashes on floaters, you're definitely going to dilate. You're going to check the pressures and all, and then you're checking for the Schaefer's sign. Is there any Schaefer's sign, any waist ring? And then you begin to look all in the periphery after dilation to check for any tear, hole, or detachment and all. Okay, so those are going to be your steps. And then when it comes when it comes to the result, it is all about, then I'm going to summarize with my result, and I will be discussing with the assessors what was the outcome or the impact. Okay, yeah. So because this is a hypothetical, you're not really seeing the patient. You could say a patient that comes to mind. You could talk about a patient that you've seen that came into your practice, okay? Or you could give them all the outcomes. And so when I finish, if it's only, if I see a waist ring and I haven't seen any holes, no tears, it's negative Schaefer's, I would do this. I would advise, I would give a leaflet. If the patient is high myopic, risk factors are beginning to increase, and I'm not too sure that I've seen the periphery to the best of my satisfaction, maybe because the patient didn't want to position well, or the patient didn't dilate well. Then you'll be talking about how you're going to be referring to the hospital, maybe for indentation, fundoscopy, or for other things. Do you get what I mean? And then when are you referring? What is your referral criteria? So that is how you would handle that. Okay, so one thing I would advise you to do anyway is, whenever you are answering your questions, you want to hit the competencies directly. If your answers doesn't map into the indications on the competencies, then obviously they can't tick that you've actually succeeded in that competency. So you really want to do that. Okay. And when you're speaking to the assessor, you can move between clinical, speaking to the medical team as you speak to the assessor, and also move between, this is how I would explain it to the patient. And I always say, add your Nigerian sauce to it. Add your Indian sauce. Let it come in it. So try to loosen up. Don't get too serious. Try to loosen up. Always keep your smiley faces. Keep smiling and keep talking, and add some drama to it. Let them know the drama that goes on in your consulting room. Okay. So that is that. Now, when it comes to your prospectus, your application form is your prospectus. For those of you that are in our accelerator program, or you are in our starter pack, or even the mock interview bundle, you do have the full competency study guide, and you will find all the layers and in the indicators of all the competencies that I've duly covered in that course. But for the rest of you anyway, you make sure you're using your application form for that. Right. I'm just going to check the chat to see if I have any questions at all. Any questions coming through? Okay, no questions. I can't see my chat. Okay, yeah, I found it. Right. Cool. Thank you. So if you have any questions, put it in the chat as we summarize right now. Wow. So I hope this was helpful. Just imagine this. You walk into that GOC interview hall knowing exactly how to tackle every single indicator in the question. You've practiced did I forget? You've practiced structured answers and you know how to connect every single thing you're saying to the competency, and you're calm because you've already simulated, the interview environment. In that, one thing I always advise anyone that comes my way is this: if there's anything you don't want to do before you do your GOC interview, is you don't want to not do a mock interview. You want to do a mock interview with a provider that covers the core competencies such as ACN Academy. Of course, I'm going to talk about ACN Academy or any other provider, but you really want to make sure that you are going through a simulated, like the real deal, going through to make sure that your answers are really structured well. Because this is when confidence shows up. And confidence, you can't fake it. A lot of people are not confident because they're not sure, they haven't practiced well. And some people, I would say, even in my case, before when I started my journey, it wasn't that I wasn't confident in what I knew as an optometrist in Nigeria, because I had coached or, mentored, or I had done supervision for a lot of optometrists coming out of school. I had over 10, 15 years of practice even before I came into the UK. And I ran specialty practices in Nigeria. I worked hand in hand with ophthalmologists. So I even worked on the ward, administering medications, like systemic medications to patients, for beetle cellulitis and all. So I had a lot, but I still knew that this is a new world. I don't know what applies here, you know. So my confidence levels wasn't that great, but after I'd gone through the trainings that I went through, the interview settings that I went through, the simulated exams, because at the time we needed to do it face to face, that was when my confidence was top notch. I had done it. We had done contact lens fittings, aftercare, sight tests, and so many much more over and again, over and again. And that's the level I really desire that each and every one of you reach before you get into that interview. Okay, if you have any questions for me, I'm just going to check the chat box. If you have any questions, let me know. Okay, great stuff. All right, now to this end, I've been working on something behind the scenes that's going to help you as an international optometry prepare at exactly that level, with a structured plan, coaching, and even a mock interview simulation, which I'll be sharing more about it as we go along. Once it's ready, I'll let you know. So make sure that you don't miss my lives, because obviously there's always something good for those that step in first. But for now, you want to focus on applying what I've shared today. So even as you're seeing patients in your clinics, think about the STAR method. Think about the structure you're taking, the journey, the customer, your patient journey. Think about their journey. Practice mapping every response, tying it to not only the core competency, but the indicators in the competency. And also remember, don't just read, rehearse out loud. One way to do that, pick your phone up. You can put it on video if you want, and you can just talk into the video when you're thinking about that cranial nerve 3 palsy or 6 palsy, or thinking about that child you saw that was at risk of binocular vision anomaly. You're just talking about that case in your video, and then listen to it. Okay, listen to it, because that is really helpful. All right, now I want to know from you, if you wouldn't mind to drop in the comments below your questions, or what is your biggest worry about the GOC interview, if any, or the process itself. I love to know. I'd also love to know if today's live helped you. And if it did, I'll encourage you to like, follow, whether you are on LinkedIn or Facebook or YouTube. Go ahead and follow and turn on the notification bell. Another thing I would request you to do is to invite another international optometrist, or at least post it on your platforms. May not be so useful for them right now, but at least it will be helpful for them as we go along. And now remember, you don't need to go alone in this process. I'm here to offer that help. So if you are going through the process and there's anything that feels like, it's not quite settling with you, you're not sure about something, and you really want to make sure that you get it right first time and you're making the right progress, I want to invite you to a free um expert guidance call. So if you want to have that's my calendar link. You book a call. When you come on, we can discuss your very own um concerns. We can map out your plan, and then if there are any other things that are not too sure, but one thing I'm sure is that by the time you leave the call, you know exactly what you need to do in order to proceed and get good outcomes for yourself. Awesome. I want to thank all of you that are here right now, whether on the live or on the replay. Keep an eye out if you're already on my email list. Yes, keep an eye out on the email list. Keep an eye out on the lives and all. And if you have any question or there's anything that would be helpful for you, you would like me to cover in upcoming lives, you can also put it in the comments below. All right. I want to say thank you so much, all of you, for coming out. Thank you so much for being here. I hope it was helpful. And yes, I will see you on the next one. You take care now.